Planning and preparation are vital to a successful dental career transition. This information will help you get started now. What is the value of a transition plan? Thorough planning will result in increased profits prior to transition, help prepare the practice for eventual transition, enhance the opportunities to transition, and increase the sale proceeds. Why start a transition plan now? The primary goal of a transition plan is not the sale of your practice. The primary goal of a transition plan should be to maximize your practice revenue prior to the actual transition and minimize your dependence on the sale revenue proceeds for your retirement lifestyle. The first step in your transition plan is to see a fee-based financial planner, an individual who is not incentivized to push a specific product or service. A fee-based financial planner will help you determine what your retirement income needs will be and what resources you will need to support your retirement lifestyle. What is a dental practice? A dental practice is the vehicle that gets you from dental school to a prosperous retirement. After visiting a financial planner, the second step in transition planning is to identify your transition time frame. Consider how long you intend to remain a practice owner and how long you intend to practice dentistry. The third step is to identify your transition goals. Is your primary goal to generate the maximum dollar value when you sell the practice? Or is your primary goal to provide a successor to your practice and reap the benefits that a successor will provide to yourself, your staff, and your patients? Whatever the answer, your transition plan will vary depending on these goals. There are about 20 different ways to transfer ownership equity in a dental practice. The most popular ones include a total practice retirement sale, a role reversal sale that begins with an associate and ends with the seller as an associate, a practice merger, a records-only sale or records sale using a production acquisition, and the associate to partner or partner buyout sale. And for some doctors, they may just work a couple of extra years to realize the additional operational revenue they would have received instead of sale proceeds and then simply close the practice without a sale. The most valuable assets to be sold with the dental practice are the active patients, new patient flow, the assembled staff, the existing business systems, and the location. The dental equipment is the least valuable part of the sale, representing typically only 10 to 20% of the sale price. If the transition plan involves or starts with an associateship, before the process is started to locate that associate, a careful analysis of the practice must be conducted to make certain the practice can support two dentists during the interim period prior to ownership transfer. To protect your practice, all associate employment agreements must have a carefully constructed non-compete agreement. Doctors cannot afford to take in an associate only to have them move across the street with 50% or more of the practice patients and staff. Even in those states where non-compete agreements are illegal, there are alternative ways of accomplishing the same goal. For instance, protecting the practice from an associate intent on acquiring the practice in some manner other than paying for it. As we consider preparing a dental practice for transition, our primary focus must be on increasing the practice receipts. Anything that increases the receipts will increase the desirability of the practice and subsequent possibility of selling the practice, increase the sale price and value, and ultimately increase profits until the practice is sold. Most doctors are concerned with controlling and/or decreasing their overhead as a percentage of their practice receipts. Any increase in receipts will also decrease the operating overhead percent. The most important key to increasing collections and decreasing overhead is charging the correct fee. Most doctors have some fees for procedures they do only a few times a year, set at the 70th to 80th percentile. They also have certain procedures they do several thousand times a year, but set at the 20th to 30th percentile. Fee balancing is the act of raising all fees to a percentile level that most fees in your zip code are already set at or below. In other words, raising all of your fees to the 70th to 80th percentile. Any fees below this level only primarily benefit the insurance company, not the doctor or patient. If seeing a dentist twice a year for dental cleanings and examinations is adequate, why does the American Academy of Periodontology report that the majority of adults over the age of 30 have varying levels of gingival and periodontal disease? Soft tissue management and more frequent prophylactic cleanings are the foundation for improving our patients' gingival and periodontal health. In addition, these non-surgical procedures add 10 to 15% increases in the practice revenue. The third most productive area of dental practice is the utilization of technology. Use of digital x-rays, panoramic x-rays, lasers, CAD/CAM technology, and the like is not only providing state-of-the-art care, but also allows for enhanced levels of care while also adding to your bottom line. So what is the practice worth? This is a question that not only do you need to know the answer to, but so does your family. Only about 30% of all dental practices sell within 90 days of the untimely death of the owner dentist, with an additional 10% selling after 90 days. This means 60% of practices do not sell if not sold within that initial 90 days. Most dentists provide all types of insurance to protect their family assets, but omit this most valuable tool required to protect the financial equity of the dental practice for their family. One of the first steps to implementing a transition plan is to have the practice appraised. This appraisal will allow the owner dentist a preliminary comparison with how the practice measures up to the industry and allows time to make changes to the practice to enhance its value. It also serves the foundation for a letter of instructions to the family stressing the urgency to implement a sale as soon as possible if something unforeseen happens. We have seen far too many instances of families not knowing what the practice is worth until after the passing of that first critical 90-day window, with catastrophic financial results. This type of planning will benefit you, your family, and your patients. Please contact your Henry Schein representative for more information. Thank you.